Hello and welcome back to my channel, doc.offcall. I'm Maddie. Today we're going to be talking about the top 5 tips to help you ace your recorded clinical assessment, or otherwise known as the RCA. Okay, so as I'm sure you're aware, the RCA, or the recorded clinical assessment, came into place just recently to replace the CSA, the clinical skills assessment, which made up the practical component of the assessment of GP trainees. Now, you know, I'm sure there's lots of you out there who don't like the fact that there's been this sudden change up and don't quite know how to prepare for it, because we've always had the CSA, and I'm sure some of you may have started your preparation early just to find that that assessment has been replaced, and that can be really frustrating. However, the RCGP have told us that this new form of assessment, the RCA, is going to be in place until this time next year, and so getting used to the idea of it being there and looking at ways for preparing for it will be really useful and keep you in good stead when your assessment comes around. Now, I was one of those first trainees to go through the RCA, and fortunately I passed. And so what I really want to do in this video is to share with you some top tips and some recommendations and a bit of advice as to how to approach the RCA and what things worked for me, at least I think worked for me, and what allowed me to get through that assessment and finally become a GP, which I now am. So if you haven't already, please do like and subscribe to my channel, because I will be covering more topics applicable to GP trainees. But let's start with tip number 1. So tip number 1 is can be summarized in a quote, and that is: fail to prepare and prepare to fail. And that was a quote that was told to me by one of my teaching colleagues when I was a teaching fellow at Newcastle University. And really what I mean by this is that we are now aware of what is required for the RCA assessment. It's going to be a recorded clinical assessment, and so there is a component of this assessment where you're going to be recorded. So the first thing to do is to talk with your practices, what sort of recording apparatus they've got in place for you to utilize to get these assessments recorded, and you're going to want to possibly record face-to-face consultations when necessary, but then you're also going to want to be able to record telephone consultations and also possibly video consultations. So it's really important, before you actually even begin to look at starting getting your assessments done, and making sure that you have the right equipment in place to get things recorded. I know at my practice, 2 weeks before I was going to begin recording my assessments, I checked with my practice manager to make sure that we had all of that equipment in place, so that when it came to the time that the window in which I was going to be recording the cases, technical issues were not something that I had to think about. They were already put in place. Tip number 2 is plan your recordings. And what I mean by that is, you could say, I'm going to record every consultation for a 2-week window, and then I'm going to just cherry pick the cases out of those that I feel would be appropriate for an assessment. And that may well work for you, but one other resource you have at hand are all those other clinicians that you're working with in your practices. Now, if you make them aware that you're going to be doing the recorded clinical assessment and that you are looking for specific cases based on the curriculum that you need to cover, then they can also look out for cases on their telephone triage lists, if that's how your practice is working, and they can direct cases to you into your clinic so that you can make sure that you're actually fitting all of the components of the curriculum, rather than seeing 10 sort of blocked ears or sore throats. So tip 3 is really case selection, and being sensible with your case selection. Now, there is a list of the curriculum items which I will put down the side of the screen, which the RCGP would like you to ideally cover, and so you're going to want to make sure that the cases that you select do match at least several of those on the list, rather than, as I said before, 10 ear infections are not going to get you a pass in this assessment. And so, you're really going to want to look at your cases and say, have I done something with women's health? Have I done something with children? Have I done something with elderly care medicine? And making sure that you're getting a good coverage of that curriculum. And this really speaks to what I was saying earlier, where, there's great value in telling your practice and the other clinicians who are working that you are doing this assessment and the type of cases that you're looking for, so that you don't just get the more sort of simple cases like UTIs or ear infections or conjunctivitis repeatedly in your clinics, because you do have that set period of time to get these recordings done by. And in addition to matching the curriculum that the RCG have put out, you're also going to want an element of complexity to the cases as well. So it's good to have a few simple bog standard cases that demonstrate that you can do the simple things well, but then there may also want to be cases where there is an element of complexity, and complexity can be brought into a case just upon discovering that the patient has, for example, other comorbidities and how their current health issues are going to affect their comorbidities. And so, if you're doing a good, thorough history, finding out past medical histories and any other patient factors, that should help to tease out some of that complexity that you're going to need to demonstrate you can deal with in this assessment. And tip 4 is really demonstrating structure in your consultation. What I mean by that is making sure that you're hitting the likely domains that you're going to be getting assessed on. So making sure that you are taking a good history, making sure that you're addressing the ideas, concerns, expectations, as well as the psychological impact of the patient's condition, and then doing some form of examination if appropriate, and then moving on to clinical management. Now, it's important to remember the domains that you're going to be assessed on for this, and those are going to be, the data interpretation and data gathering, the interpersonal skills and clinical management. And I'll be producing a second video to supplement this, which will talk a bit more in detail about the system that I used when doing my consultations. And so just look out for that video. I'll be putting it out sometime in the near future. And finally, and most importantly, tip 5, which is keeping to time. So we are aware that the time frame for these assessments is going to be 10 minutes. And so you really want to make sure that you're within that time frame and not risk your cases you put forward being void as a result of overrunning. And really, I think if you're doing tips 1 through till 4 really well, then really your time management should be okay for this. All right, so making sure that you're prepared for your consultations, so that you've got all the equipment in place, you've got enough time set aside for you to consent your patients before they come into the room. You want to make sure that you've got appropriate case selection. You want to use a good structure in your consultation so that you're hitting all of those domains and not rushing through clinical management, which is what a lot of trainees end up doing. And then you also want to just plan your recordings. Make sure that you're not bringing down someone who's got 7 issues that they'd like to discuss in consultation with you, and possibly capping it at 1 to 2 at the most. Okay, so I hope those tips were useful, and just to summarize them once again. So tip 1 would be make sure that your practice is set up for your recordings, so prepare for your recordings. Tip 2 is plan your recordings, so make sure that you know what patients are coming down into your clinics, so that you know that that case is going to be an assessment case that you're going to be possibly submitting, and recruiting on board other clinicians to help with making sure you're matching the curriculum for what's needed. Tip 3 is that case selection. So really make sure that you've got an element of complexity in some of your cases, and make sure that they're not too much within one case, and make sure they're not too simple at the same time. Tip 4 is ensure that you use a structure when you're consulting, making sure that you're hitting all of those domains, from history taking all the way through to clinical management, ensuring that you're having your interpersonal skills and you're gathering the right data and interpreting it appropriately. And then just finally, it's time management and making sure that you stick to the recommended time of 10 minutes for the assessment. So I hope this video was useful for you. I will be putting out more videos around GP training and top tips, and one that will be coming out soon will be looking at what structure that I used when going through my recorded clinical assessments. Now, if you found this to be useful and you'd like to see more content, or if you have any specific queries or specific questions, please leave those down in the comments below. But otherwise, please do like and subscribe, and look out for the next one. Thank you.